Domestic violence, also known as intimate partner violence or IPV, isn't just a relationship issue. It's a major public health concern. According to the CDC, nearly 1 in 4 women and 1 in 10 men report experiencing some form of IPV in their lifetime. This includes physical, sexual, emotional, psychological, and economic abuse. In fact, the World Health Organization calls it a global epidemic that affects health, human rights, and safety. Survivors may experience PTSD, depression, anxiety, low self-esteem, brain injuries, migraines, joint dislocations, reproductive issues, fractures, and chronic musculoskeletal pain. Many survivors also face long-term barriers to independence, including loss of employment, housing instability, educational disruption, and reduced productivity. In the US, over $5.8 billion is spent annually on DV-related injuries, with $4.1 billion going to healthcare and $1.8 billion to lost productivity.
But what makes this topic relevant to OT? Abuse just doesn't cause injuries, it disrupts people's ability to live. Survivors often experience what's called occupational injustice, where survivors are denied the ability to participate in valued activities due to power, control, trauma, or physical limitations imposed by their abuser. Survivors face barriers including educational, vocational, financial, physical, and psychological barriers.
As OTs, our goal is to help people participate in everyday activities that matter to them. Here is a snippet of a podcast with Dr. Mark Koch, who is an OT and educator who focuses on trauma-informed care and community-based practices.
I found I had a really, I didn't fully understand how useful my skill set would be until I started working in that environment. So, when we had cases that involved children, I could get out my OT bag of tricks from when I worked as a school-based practitioner and do activities that would help calm the child down so that they could testify, or I could help a parent understand how the trauma would be impacting the child's occupations, their development. I could also, help articulate to a prosecuting attorney who would be taking a case forward, how that crime had impacted that individual. And most people, what I found is most people either don't know what their rights are, or they assume that they have rights that they don't have. And
Yes.
So when you experience a loss of control, you really want to get that control back. My role was to help them understand that they weren't alone, and that often what they were experiencing was, while it was uncomfortable, it was normal. And maybe, even unpleasant, but, really help them understand that they didn't have to navigate the system alone, and then help them get connected with resources in the community that might help restore them financially, physically, emotionally. And then worked with a whole team of, prosecutors, law enforcement officers, probation officers, community-based advocates. We had in Columbia, Missouri, it was called the Domestic Violence Enforcement Unit. So we had a federally funded team that would follow women who were victims and survivors through a case from the initial investigation through the disposition. And we would be supporting her every step of the way and pointing her in one direction, not 10 different directions, as it often happens.
As we heard from Dr. Mark Koch in his podcast, where he emphasized how occupational therapy can play a crucial role in the recovery journey of survivors of domestic violence, not just by addressing tasks, but also by restoring identity. According to the OTPF4, occupations are more than just tasks, they're identity shaping. Survivors might feel disconnected from their roles as parents, students, or workers. OT interventions like skill building, assistive technology, emotional regulation training, parenting support, and social participation programs have been shown to improve survivors' satisfaction, autonomy, and ability to reach their goals. For example, OTs working in women's shelters have helped clients build safety plans, develop coping strategies, and rebuild their sense of agency. One study found that group OT sessions improved self-efficacy, confidence, and emotional well-being. Designing interventions grounded in trauma-informed care, advocating for housing, legal, or employment needs, and supporting routines around rest, hygiene, and emotional regulation. These are all ways occupational therapy empowers survivors to reclaim control and rebuild a foundation for long-term healing and independence. A 2024 survey revealed that most OT practitioners lack the training and the confidence to effectively support survivors.
Domestic violence doesn't look the same for everyone, yet intimate partner violence remains a taboo topic, especially in healthcare. It's under-discussed, under-taught, and too often overlooked. Cultural stigma, language barriers, immigration status, and discrimination all impact how and whether survivors seek help.
This results in missed opportunities for early interventions, inconsistent use of trauma-informed care, and gaps in survivor support.
Healthcare systems have both the power and the responsibility to close this gap. That means investing in training, funding OT positions, and promoting collaborative, inclusive models of care. Still, clinical environments often lack the tools and protocols to respond.
And yet, meeting immediate needs is just the beginning. Leisure and identity affirming occupations, though often deprioritized, emerge as a critical part of long term recovery, aligning with Maslow's hierarchy of needs. How can one begin restoring self worth and joy if they do not feel safe or have access to food, housing, and support in order to reach for autonomy, identity, or growth?
Looking ahead, the profession must also embrace its role in policy and system advocacy. This includes integrating IPV education into OT curriculum,
Developing and sharing evidence-based intervention protocols for use across settings, contributing to research that centers survivors' voices and tracks long-term outcomes.
Partnering with public health initiatives to position OT as a critical service in DV recovery. AOTA now formally recognizes IPV as a key area of practice. This marks a turning point, an invitation for OTs to step more into interdisciplinary leadership and survivor-centered innovation.
This future isn't hypothetical, it's already being built by practitioners who are reimagining what OT can be and survivors who are courageously rebuilding their lives.